Hello, welcome back to the Journal of Oncology Practice podcast from ASCO. This is Dr. Bob Miller, consultant editor at the JOP and medical oncologist at Johns Hopkins. Social media is a worldwide cultural phenomenon that has affected the social landscape of virtually all developed nations, social classes, industries, and organizations. With over 800 million users worldwide, it's hard to avoid something like Facebook these days. Social media has penetrated healthcare and medicine, so it's inevitable that patients and healthcare professionals will increasingly have opportunities to interact in this space. However, the immediacy and ease of use of social media bring a certain tension and uncertainty about professional boundaries and privacy issues faced by both parties on this new landscape. In the March issue of the Journal of Oncology Practice, authors from the National Cancer Institute and the National Institutes of Health provide some insights into these issues in a commentary entitled, "To Friend or Not to Friend: The Use of Social Media in Clinical Oncology." I'm pleased to have the opportunity to speak with two of the authors of this article about this very interesting issue. Let me introduce Dr. Lori Weiner, who is co-director of the Behavioral Science Core and head of the Pediatric Psychosocial Support and Research Program in the Pediatric Oncology branch of the National Cancer Institute. She dedicates a substantial portion of her time to applying knowledge from her research findings and clinical experience to create innovative resources to help youth living with life-limiting illnesses and their families. Dr. Weiner also provides services to support staff, including a year-long wellness series and a bereavement program called Good Grief and Chocolate. And speaking as a chocolate fan, I do love that name. Welcome, Lori.
Thank you.
Also joining me is Dr. Melinda Merchant. Dr. Merchant is head of the Clinical Sarcoma Program in the Pediatric Oncology branch. She is a clinician scientist with a focus on adolescents and young adults with sarcomas or other rare tumors. Some of her ongoing work includes immunotherapy trials for high-risk sarcomas and a molecularly guided trial for neuroblastoma. She is an avid reader of blogs such as Mothers in Medicine, and you might find her catching up on Facebook late at night when she should be catching up on her sleep. And welcome to you as well, Melinda.
Thank you for having us.
So you start the article with a vignette about receiving a friend request on Facebook from the mother of a former patient. Talk about the issue of professional boundaries in social media for oncology professionals. How can this affect the therapeutic relationship?
So that last question is exactly what we want providers to consider before making that social media connection. How can it affect the therapeutic relationship? There are risks involved. These social interactions outside of the clinical relationship could impair one's clinical judgment, or potentially make it difficult to deliver bad news if needed, or to deal with a non-adherence issue appropriately. Conversely, rejecting a communication from a social media may seem like a rejection to the patient and negatively impact the trusting therapeutic relationship. So there's lots more issues than just, is it worth me seeing what is going on in this person's life?
What are some of the legal and ethical considerations about these types of interactions that we should be aware of?
Well, such questions are still evolving. Certainly, there's legal concerns about potential violation of patient privacy. In the article, we cite a case where a medical student was dismissed for inappropriate postings. There's also many instances of nurses being disciplined, suspended, or even fired from their position because of inappropriate postings. And these could be in the form of pictures with patients, comments about the workplace, or even comments about one's colleagues.
We pictured a provider being a physician, a nurse, or a psychologist who is pondering over some of the dilemmas that can raise ethical issues based on information that's delivered about a patient. Things that you might find out from pages that you may not bring up in a clinical setting, including using illegal substances, although we do ask that question often in clinical settings, involved in illegal activities or type of relationships. So what would you do if a patient is expressing suicidal ideation on a Facebook page? Or what if they boast about not taking their meds? They say bad things about you or your practice or your staff. Each of these can raise complex ethical dilemmas, most of which probably be avoided if you don't communicate outside of work with the patients on their personal social network site.
You mention another negative impact, which is the effect on the work-life balance as a potential risk. Can you describe that a little bit?
Well, you may have noticed that there's some people who just feel they need to constantly check Facebook, not wanting to miss out on something that's going on or something going on with their friends. And this clearly could distract them from work. But perhaps more importantly, if providers get home and they find themselves communicating with their patients or their patients' family members via social network, this is not only taking time away from their own family or friends or activities that they may be involved in outside of work, but they don't really get a break from their role of caring for patients. So providers need to consider whether there's a balance between the relationships that they're investing time and energy in, both inside and outside of work. What we find is that when there's no off time, emotional energy gets depleted, providers become tired, and they become an increased risk for what's often referred to these days as compassion fatigue or even burnout. So therefore, if one realizes that they're spending time communicating with patients after leaving the office, and then they find that they have less time for those in their life outside of work, it's time to pause and to reflect on who's going to be by their side if their job is no longer available.
Sure. In the article, you have this very nice color figure, which for the listeners is figure 1 on page 104, and it's entitled To Friend or Not to Friend. You talk about some of the items that should be considered first before you accept a friend request in the first place, and probably even more importantly, what you should consider if you get to the point where you want to unfriend a patient or a patient's family members. Can you go through that just a little bit and give us some examples of the different things that we should consider in both the accepting a first request and sort of ending a relationship on social media?
Sure. We intended the picture to look like a traffic light with the red at top suggesting a pause to think about such issues. What is my intent in creating this connection? Am I accepting for my benefit or my patient's benefit? And are there institutional guidelines before I click accept? The middle was really a cautionary light, where some readers might find themselves who have previously accepted a friend request but start to realize the implications of that blurring of professional and private boundaries. This is the time about reconsidering. How do I gracefully defriend to minimize the damage? Or has my online communication detracted from my ability to do my job well? And then there really is a green to this traffic light as well, because we do believe that there's a making a go of social media, that it's not all potential mores here, but there are potential important necessities to social media, especially when you're talking about adolescents and young adults. And that making a go of social media, if you know your audience and that's the best way to reach them, that these sites may help you better get the information across that needs to be gotten across. We also say that in that making a go, that the institutions should really consider the guidelines for success while minimizing the risk to patient privacy. We emphasize the necessity of having that institutional policy. It helps to take the pressure off the provider. It allows for consistent responses to patients, and so they don't feel like some staff will where other staff will not.
So I'm really glad you brought that up, because I think too often when you read about the use of social media and the relationship with health professionals, you only hear about the negative things and the risks inherent. And so it sounds like what you're saying is that maybe in particular for an adolescent or a young adult population, this may be a very helpful tool to further the therapeutic relationship.
Correct. I very much agree with that.
So you also talk in this figure, you talk a little bit about some of the risks to the oncology professional, things that the patient family member may learn about the physician or oncology professional. What are some examples, or what are some landmines that should be avoided in this area?
So if the provider has a side that's very different than their professional persona, this may very well get exposed on Facebook or another social networking site. This could include one's political views, dating, or family life, because one can't control what their Facebook friends might say about them or what photo they may be tagged in. Are they going to see their physician at a party years ago, with their girlfriend, boyfriend, or someone perceived to be so, with their children, in a bathing suit, with their parents, in their own bedroom? So by accepting a friend request from a patient, providers really need to be aware that their patient and their patient's family and friends may know what they are doing outside of work and who they spend time with.
I'm having trouble getting past the bathing suit comment, so let me just wrap my head around that for a minute. What about guidelines? You mentioned that there are institutional guidelines in some cases. Maybe that's more the exception these days. How about professional societies? Like the American Medical Association came out with a set of guidelines a couple of years ago. In your opinion, do you think these are helpful?
I do. I mean, overall, the available guidelines are very good, but they're also pretty general. So while available guidelines reflect the difficulties associated with blurring patient and provider boundaries, ethical and legal issues, they really can leave a lot of room for interpretation. Increasingly, professional societies are developing their own social media guidelines. The American Nurses Association, they have a social networking principles toolkit and a fact sheet titled Navigating the World of Social Media. And examples like this are a really good start, but none of them are really going to fully address the legal and ethical considerations that are raised when you accept a friend request, which is why we wrote this article.
Now, we've been talking mostly about Facebook interactions, or at least similar to Facebook. Obviously, there are multiple other forms of social media, Twitter, Google+, commenting on blogs and so forth. Is there anything different about these or any different considerations?
I think there are different considerations depending on the social media and how it's structured and how your interactions with both the person that you immediately attach and the people surrounding them in their network per se. Medscape just recently released results showing that half of the pediatricians use Facebook, and the other services were not as much used. So we pretty much focused on Facebook in this because it is what's most common to the staff that we know. But I think really regardless of the platform, the message of being a friend versus being a provider can be crossed with personal interactions on these sites. They all provide a forum to access information that we would not otherwise be privy to, or give patients the information about us that we may not have discussed with them before. However, looking at the good side of social media, again, getting the word out about important prevention details may be very important by a Twitter account in accessing some of the young adults. Individual blogs are a great way about getting detailed information about individual diseases that you would like to disseminate as somebody is first trying to learn and be educated about a new diagnosis. So I do believe that there are very different roles for the different media sites, and it probably is a case that not one set of policies affects all of them or can cover all of the nuances that happen in the different social medias.
So I think you may have covered this already, but what are the big questions that still need to be answered about social media and health professionals?
We really hope that this article would get people talking about that, and along with the other articles about this in the literature that are starting to pop up, really begin to look at these issues. And we hope that they will prompt the medical education field to include social media in their training. We encourage the setting of policies by institutions and associations that would address professional boundaries and the importance of maintaining a healthy work balance. But really, we're hoping to start a conversation about this so that the provider is given some of these things to think about before just clicking accept.
So bottom line, what's the right answer to the question in the title? Should you friend or not friend?
So as Dr. Merchant said, physicians should not shy away from using social media. Social media will likely play an increasing role in healthcare. However, keep the principles of patient confidentiality and privacy, respect for employers and colleagues, and patient professional boundaries utmost in your mind. The reality is there is no telling what will happen when you get a friend request and you hit the accept button. Accept that you are opening the door for your role to be recategorized or to simply shift from provider to friend. And with this comes the potential risk of potential boundaries becoming blurred. But one has to really remember that whatever you write on that patient's wall will remain on the internet, even if you pull it from your own Facebook page. You may see or hear about it and what you had said many years down the road.
Dr. Weiner and Dr. Merchant, thanks very much for talking with me about this interesting topic this afternoon.
Thank you.
It's our pleasure.
And thanks again to our listeners for downloading these JOP podcasts. And as always, please give us your feedback on our iTunes page or by email at jopeditorsdesk@asco.org. Be sure to check out the March issue of JOP for lots of other great articles. This is Dr. Bob Miller for the American Society of Clinical Oncology. Thank you very much for listening.